Saidibu. We are from BARAF Foundation, and we're here to talk about mental health in women. With me are
Amina Mede.
In the society today, we've noticed that a lot of people focus more on physical, emotional, and financial aspects of life. When you talk about mental health, they try to dismiss it. So today, we would like to enlighten everyone on what mental health is.
Thank you very much.
Yes.
Mental health is a very important aspect of life, which many people dismiss. I would say that mental health is the psychological, emotional, and social well-being of someone's life. Mental health can affect the way we interact with others, the way we feel, the way we act, even towards circumstances in our lives. You can notice that some people overreact and some people underreact, and you can ask why, and sometimes you find out that they have some underlying factors which can also lead to some mental unhealthy behaviors. In mental health, I think there are different types of mental health disorders, which are schizophrenia, depression and anxiety, bipolar, multiple personality disorder, and the rest. So in this discussion, we are going to be focusing on the mental health of women, how to help them, and the treatment, the causes, the symptoms, and also how to talk to them when we find out that this person has mental health disorder. Thank you.
The part you spoke about overreacting. If we're in an environment and we see someone behaving different from usual, how do you approach that kind of person? Because when you talk about mental health, what comes to your mind immediately is, oh, you are mad. Oh, I can't associate myself with that.
Yeah.
So how do you think is the best way to call, to bring that person into the light, to know what mental health is?
Okay. Sometimes mental health, like I said, it has different phases, it has different stages, different types. So if you are not clinically inclined, you won't be able to actually decipher what mental health disorder this person has. So mental health disorders need to be medically diagnosed before they would say, okay, this person has schizophrenia, this person has psychosis and all that. I would like to define depression as the pervasive mood disorder, whereby they are always feeling sad, they don't want to indulge, or they overly indulge. When you notice a change in pattern in their way of life, you can actually call them to order in a non-judgmental way. Give them a safe place, an honest hearing, so they can be comfortable to open up and tell you the reason why they are depressed or why they are acting the way they are acting.
Right. Moral support, like it's the first thing. Like you need to give them moral support because it gives them this confidence, to now be able to, oh, this person understands me, so I can share with you like what I'm experiencing, what I'm feeling, and from there the person can now decide to, okay, we can go see your healthcare provider, and from there you discuss. If you are now diagnosed with, okay, a type of depression, from there you can now start your treatment. And
when we talk about this mental health in women, you know there are different aspects. Now, to think of pregnancy, there's this notion that comes in, oh, you've given birth, you're supposed to love your child. Why are you now pushing the child off? What is that? You're depressed. Why? What's like? So I need more explanation on that.
Actually, on that, there's someone I know that experienced that depression after birth of their child, their baby, and then the partner, her husband, was like, "Why are you depressed? Like I'm providing for you, I'm doing everything I need to, and what is making you depressed?" Because he lacked the understanding. But for pregnancy, actually, we call it perinatal depression. Perinatal, which has to do with during and after pregnancy. So during pregnancy, prenatal pregnancy, that's prenatal depression. That's when you experience it when you're pregnant. Then after giving birth to your baby, you call it postpartum depression. Postpartum depression, it has to do with mood changes because depression generally, describes that, and from there you can lead to psychosis, as she said, which is very, very severe. When a person is diagnosed with that, it needs immediate treatment. It's an emergency, case. Yes.
In women, there are various factors that can affect their mental health. For example, marriages. At a certain age, it's expected that you leave your family house and start your own family. They'll be asking you, where is the husband? When are you getting married? You are next, so what's this, what's that? Do you get?
Yeah.
And then, without knowing, they're already putting pressure on you. You're acting differently. Once you go out, you're looking for, where is the man? Let me come in with somebody.
Yes. Yeah.
Or in the case of being the first daughter, why are you out here when you're supposed to be here cooking food, breakfast, lunch, dinner? You don't have a life.
Exactly.
You are actually just living for them. All the sacrifices, all of this, and they can't even, they don't expect you to have an issue with it.
Yeah.
They don't sit down and say, okay, how are you? How is this? That's generally in society. They expect you are strong enough to take it. So, what do you have to say about all these factors?
Okay. I would say that before adolescence, depression is almost the same range between boys and girls. But once girls start reaching the puberty stage, depression kicks in. There are lots of things that they already start projecting on the girls. You need to behave like this, you need to do this, you need to do that. And you can see these things mostly in our society. So once the girl is growing, she's growing with lots of expectations on her shoulders. And sometimes, like she said, the first daughter stuff. Many people that are first daughters, the parents make them feel like you have to be perfect. You can't make mistakes.
You have to be a role
You
model.
have to be a role model.
Yeah.
So you begin to see that they start living their lives not for themselves, but for the family, for their siblings, in order to leave a legacy. Now, while leaving a legacy, they don't ask them, oh, are you okay? Am I doing too much? Is this too much on you? Even first daughters, they want them to get married before the second ones. They want them to just marry, just bring any man to us. All those things stress women out. From puberty, the menstrual cycle starts, they start developing breasts, and they start becoming, their body physique becomes more defined. The guy issue starts. You start to see some guys who throw some statements at them, trying to define how their body or how a woman's body should look. And this can also make women depressed. You can see now that many women are going into different cosmetic surgery in order to look perfect. If you go into study, you find out that most of those women are depressed because of the stigmatization they've gotten or the body shaming they've gotten from both females and the male gender. Then down to pregnancy, she said once a woman gets pregnant, that's even a new form of depression altogether that is not talked about. So let her say that.
Your body changes, like once you get pregnant, start experiencing a lot of emotional, feelings. Anything literally, gets to you. Like you're just calm now, and blessing might just do. Women can just do something that doesn't warrant any reaction, and before you know it, you're pissed. So it's really something. It's something you call baby blues after delivery, after you give birth to your child. Mostly it's also like a mood thing women experience during probably 3 to 5 days after birth. Some people could experience it up to 2 weeks, yes. So in this, mostly you have sleeping issues. Yeah. Also this you cry. You're just all of a sudden you feel emotional. You just want to cry. Yeah, I've experienced it.
Wow.
You just want to cry without anybody really doing anything to you. You are also anxious too. So, but that lasts within this time frame. But if it should exceed, that's when it can be depression. That's when depression sets
Exactly,
in.
because that's what I'm going to
Yes.
ask you. Because this postpartum depression and
Yes.
issues.
Yes.
So if it exceeds this limited time,
Yes,
then-
exceeds 2 weeks, that's when it's depression. When it passed baby blues,
yeah.
depression, you can experience postpartum depression either 5 months after birth, even a year after giving birth. Yes, you
And it's
can.
still under postpartum.
It's still under postpartum.
Interesting.
From maybe a year upwards,
Yeah.
that's when it can now be diagnosed as another type of depression.
But this just reminded me, there was a time I went for an antenatal day in primary healthcare clinic.
Okay.
So what surprised me was how they came with their husbands and they interacted well. They were able to, the exercises they were doing, you see the men, they were happy to chip in and support their women. So I feel that's something we don't see a lot, and we want more people to actually, more couples to do that. They should not see it as something for just the women,
Exactly.
right? It should be something mixed, so they can actually, even though they're not the ones carrying the baby, they can experience the journey of pregnancy.
If their partners understand that women are soft and our hormones can mess up with our feelings, if men understand that they need to be softer with women, they need to be kind, if our families can also understand that, oh, like I need to look out for my girl child, she doesn't necessarily have to be so perfect, I think it's going to actually help
Yes.
women a lot.
A lot, because hormonal changes, like it's an issue up to now. Men don't understand. Okay, you go through puberty, that aside, then you start experiencing your menstrual cycle. You know, in that menstrual cycle, you have symptoms, cramps, mood swings. You know that coming. Then ovulation sets in. It's another one. Then you get pregnant. Then you give birth. And then so we are
menopause.
yeah,
Just
menopause. A lot really happens to us. Men seem up to now, some men don't seem to understand this and they are not willing to, to learn.
Yeah.
And that stigma is one of the things that's the biggest factor
Yes.
that prevents people from seeking help. Now, what do you think? What ways can we treat or prevent this?
Also, depression. If you are diagnosed of depression or you feel you're depressed, I would say seek clinical help. Go to the hospital, get a therapist, talk to someone. Because sometimes before depression will advance to a very difficult stage, you're already feeling it. So at that moment, open up, talk to someone that you can trust. Because the moment you open up, you've given yourself an edge over the depression. But if you feel like you can't open up, seek clinical help, get a therapist, start taking your medications, and you'll be better.
For medications, once you start treatment, medications have been administered. People from 25 years below, when they start their treatments, you have to pay close attention to them because it is said that there are high chances of suicidal thoughts once for the first few weeks of the medications.
Okay.
So you have to keep a close watch on them.
So how do we prevent this depression? Like, how do we take care of our mental health in general? What are the tips you want to leave us with at this point?
We should always try and be, social.
Yeah.
Yes. Social interactions, have someone to talk to, be also physically active. Even if probably you feel going to the gym is going to be stressful or something, try taking walks. That will help. Eating healthy meals, that's also very important. Try having healthy thoughts, the way you think, the way you also behave, and not taking things too personally. Because sometimes, like we're having a discussion, you might say something that it's not really deep, and then you take it differently. So
I think that's where this stuff of always surround yourself with good people.
Yes.
Because those people around you will affect your behavior one way or the other. Even if you don't know, there are some things you do like, okay, this is this. I would have done it differently. Supposing I was in this situation, or what would this person do? So all those things, they affect you without even realizing it.
If you've been depressed in the past, chances of you being depressed again is very high. Depression is not a good place to be in. Anxiety and depression is not a good thing. So you have to be okay for yourself first. Please remember that no one is putting pressure on you to perform. You have to be okay for yourself. Have happy thoughts. Go to the gym. Eat good food. I feel like eating good food alone makes you happy.
Yes.
You can even journal. Journaling is also a very good way of helping with your depression. Write down things you like about yourself. Write down things you appreciate about yourself. It makes you feel good about yourself, and it chases away the gloominess.
Okay, adding to what you said about like things that can make you have this depression, like family history. Yes, family history too can be a risk factor for that. Then women that have gone through treatment for infertility, they are of high, yes, they can go through that too. They have high chances of getting that too. Then again, hormonal changes, because of estrogen, progesterone rises, and so that too. Then people too, I think, with thyroid problems too, they have high chances of getting that.
All right, thank you very much for this session today. I hope you all have been enlightened and you enjoyed this. Yeah. Don't forget to share, like, comment, and subscribe. Thank you for listening. See you next time.
Bye.